welcome. Helen, I'd love if we could quickly just share the 90-second video to get us dove right into this thing. That would be amazing. Let's share it. All right.
Well, the speed of sound ground is 335 meters per second. This is moving at 1,500 meters per second.
My initial thoughts are game-changing. I think that it's going to be a revolutionary treatment for us to give to our athletes and be able to help them get back and do what they want, perform their sport and get to do what they enjoy doing. And that's going to greatly help a lot of our treatments and some of our injuries that we see in college athletics.
I think this is going to be a big benefit to us in our programs, especially when it comes to particularly my athletes, where we have a lot of chronic overuse injuries from how much they do of running, that we're going to be able to get a lot of them back onto the course or onto the track a lot quicker.
It still sometimes amazes me. I still kind of nod my head. I'm like, how's it really working? I know how it works. I know the science. I teach it. But when you have a patient who's a bone-on-bone knee and you think that they need, and they also have been told they need knee replacement, and now they're playing pickleball and running around and they have no pain and no dysfunction, it makes you scratch your head. You're like, how's that possible?
Amazing. I love the way that video came out. Welcome wherever you guys are coming from today. Welcome to the live webinar. We have a diverse group here. We've got an athletic trainer. We've got chiropractors here. We've got physical therapists. We've got people from all around the country, even from all around the world, depending on if you're in the Facebook group, Instagram, wherever you're watching this from. So welcome. And we have the privilege of speaking with Nick Goldstein today, who is an athletic trainer that oversees the wrestling program at Oklahoma State University. And since joining OSU in 2020, he has played an absolutely pivotal role in making sure the health and peak performance of the student athletes is of the highest quality. He's got an extensive background in athletic training and has different certifications in most of the advanced techniques that many of you guys know about, fascial manipulation, dry needling, all of those different types of things. And he has a specific passion in sports medicine and brings a wealth of experience to this discussion. So today, what we're going to do is we're going to hear a little bit about Nick's journey, what he's been doing with the athletes over there at OSU. And then since OSU just added the technology, we're also going to learn about how he's been using StemWave with relation to the athletes, how it's been helping them, and really what the future of this technology looks like in different medical institutions. So with that, Nick, welcome. I'd love to hear just a little bit, if you could tell everybody about your background and your role as an athletic trainer at Oklahoma State University.
Thank you. So I did my undergrad at the University of Northern Colorado, did a bachelor's in athletic training, and then I came to Oklahoma State as a GA originally. I was working with our track and field program and earning my master's degree. Basically got my master's degree paid for and got to also start my career at the same time, which is a pretty nice gig. And I started during the pandemic. So a pretty crazy time to start in the athletic training realm and the medical world for that matter. And basically, we got into a situation where our wrestling athletic trainer decided to take a different job. I came over, moved to wrestling. They had a good year. Our coach wanted me to stay, so I ended up staying full time. My main role is just working with the wrestling program. So I'm kind of the center for all the care needs for our athletes. So I'm coordinating if they need to see an orthopedic, if they need to see one of our physicians. I'm kind of coordinating return to play guidelines, working with our strength and conditioning staff, our nutritionists, and just kind of working on all the realms of everything needed for their healthcare, whether that's from a nutrition standpoint in the weight cutting aspect of wrestling, whether that's modifying strength and conditioning so we can get them proper rehab strength, get them back on the mat, and then also just making sure we're getting them back safely and in a way that they're going to perform at a high level. So that's kind of the main role of what I do.
That's amazing. It's all encompassing. And I'd imagine, wrestling is pretty intense. So I'd love to know, what are the student athletes most commonly dealing with relation to chronic and acute, musculoskeletal conditions? What are they seeing? What are they dealing with? Like, what are the common things they walk into your office and they're like, Nick, I can't do this anymore. Like, what's going on? Like, tell us what some of the things you see are.
So wrestling, I always describe it, it's basically fighting. It's a very controlled fighting, which is very specific rules. So with that, I mean, you're basically ripping on joints all the time, 24/7. Wrestling, the way you get better at wrestling is you wrestle. You keep doing that. So every day they're wrestling. Sometimes they're going live and going full contact. Sometimes they're kind of slowing it down. So you see a lot of acute things, whether it's MCL sprains, LCL sprains, ankle sprains. I'll also see like some shoulder impingement, like an acute kind of impingement of the shoulder. We'll see labral tears. I don't see a tremendous amount of chronic things. Sometimes if I have a guy that's cutting weight, I might start seeing some running specific injuries like shin splints and stuff like that. But mainly for the most part, I'm seeing a lot of just acute injuries and trying to navigate getting them through that acute process of the injury response and getting them back into returning to play.
Wow. And like, give us an idea. How big is the team?
I have 33 right now on our team.
And of the 33 people throughout a whole season, what percentage of them will deal with some sort of chronic or acute condition where they're like, I need some help with this?
It's probably going to be 30 to 40%. We have 10 guys that start, but then our freshmen and our backups will go to open tournaments around the country they'll go unattached on their own to compete, get better. And so they're still basically competing. The whole team's essentially going around competing. And so I'll see a variety of things that happen not only on our varsity team, but also just the backups going around and trying to get better as well.
And let's take a step back here. Like prior to StemWave, what are some of the most common forms of treatment and modalities that you guys are using for in season or even out of season athletes that are dealing with these types of cases?
Mainly just the first thing I would use, I use the Game Ready a lot, just essentially with that initial injury response, just trying to decrease any second injury response from the area, and also just trying to decrease swelling, decrease their pain. Also just using some E-stem, essentially just trying to kind of mask the pain, give a little bit of Band-Aid so we can kind of work through some of those milestones you need to hit, restoring range of motion, getting their strength back, and starting to kind of progress them forward. So that was kind of traditionally, I was relying on a lot of those. And then sometimes dry needling as well, just to kind of just activate that inflammation response and try and just as quickly as we can speed up that initial injury response time.
Amazing. And then, at what point was it like, actually, this is a question from me to you as well. So this will be exciting to know, but like, how did you guys hear about StemWave? Like, how did the conversation come up to begin with?
So I had an athlete from the Air Force that transferred to our team this year. He was supposed to start serving for the Air Force, but got a waiver to compete for his last year of wrestling. And he's trying to win a national title. So he wanted to come to a program that has a little more history and a coaching staff that could develop him. And his parents are actually chiropractors that have one of the units. And he loves StemWave. He believes it's the best thing in the world. He would get treatments while he was in Colorado Springs from a provider down there. And so the conversation started with his mom talking to our coaching staff and said, do you think we could find a way to get this unit down here? My son loves it. We've seen great results with it. We think this is a game changer and that the sports medicine staff at Oklahoma State can really enhance their care for their athletes if we bring this unit down. So that was kind of how it kickstarted. And actually, when I told him the first time he came on campus and told him we were getting one, he was ecstatic. He was getting it weekly. He tells all the guys on our team, he's like, this is the best thing in the world. It don't matter. Like, you can have the littlest pain in your shoulder. You get treatment with that. It's gone. He's like, all your soreness, aches, pains you get from wrestling will be gone with this thing. Just praised it. So that was kind of how the
conversation. What was he using it for? Like, what was his situation? I mean, he was probably like the rest of the athletes, or
mainly it was like he had some knee injuries in his past. So he said MCL sprains he was using it for. Sometimes shoulder, just kind of general aches, pains, stuff like that. I've used it on his thumb just for kind of some chronic, just kind of maybe gamekeeper's thumb, stuff like that.
Yep.
But he kind of used it more as like a recovery modality instead of maybe using it to enhance like a traumatic injury. He's been pretty healthy his entire career. So it was more just trying to keep him like a tune-up, essentially, trying to keep him fresh, kind of keep anything that could be possibly built into an injury like trying to kind of maintain that so it doesn't become something worse.
Yeah. Amazing. And I think that kind of leads us into a conversation about like it arrives, we come out, we train you guys. And how are you guys using it with the athletes? Like how often are you guys using it? What are you using on? Kind of walk us through the day-to-day of having StemWave in an institution as historic and notable as you guys.
It's getting used pretty consistently throughout the day. So we kind of have a good flow of just when my practice schedule is. And then, in this main training room where we're at, all our Olympic sports operate out of here. But mainly men's, women's basketball, and wrestling are in here the whole time. We have some satellite facilities at our other facilities for track, tennis, golf that they can go out to. But for the most part, we're seeing it used throughout the day. Track and field will come in the morning. They'll have a bunch of people that need treatment for it. Men's basketball will have a practice in the morning. They'll get done. They'll see treatments for that. Same with women's basketball. Same with me. And then even we've had our cheer and pom team also using it as well. So it's getting used pretty consistently right now. I think we're averaging about 30,000 shocks a week on the unit. So we're going through about 60,000 shocks every 2 weeks. But it's being used a lot, and it started off slow, but I can tell that people are getting results because it's getting used more and more. Like
Yeah,
it
I'm
was
doing
kind of
some.
me initially using it, and then as people started to kind of try it out on things, now all of a sudden more sports and more athletic trainers on our staff starting to use it, and you're starting to see them using it for a variety of things.
Yeah, I'm just doing some back of the napkin math as well. So for context, 30,000 waves, it's about give or take 50 treatments a week. So, it's a good amount of treatments that are happening, maybe more, maybe less, depending on how many waves are used. But, it's interesting because a lot of people here on the call today, they're used to seeing some of them are, I would say probably maybe half of them are used to seeing a demographic that's not athletes. Maybe it's the elderlies, it's the working professionals, it's the blue collar workers, it's different types of people who are, silently enduring some sort of pain and desperately seeking a transformation. And that's why they're reaching out. But a lot of our audience also does see athletes. In fact, we have many physical therapists, we have many chiropractors, we have many sports medicine doctors who it's their sole job really just to see teenage, maybe early 20s athletes, really high school and college athletes at that competitive level. And so I just love to know from you, how do you feel like this changes things in terms of what's possible with an athlete who is, just going through so many ups and downs of trying to build their early career, maybe dealing with injuries? Like, how does it change things for you as an athletic trainer and a medical professional?
I think it allows me. I think the biggest thing I've seen is it's helping me achieve some of those milestones I talked about that you have to get through to recover from an injury quicker. For example, one of the first ones cases that I got to use it from start to finish with, I had a freshman come in with a meniscus tear, and we went and did a meniscectomy, cleaned it out, and I used Shockwave pretty much right off the bat. As soon as those sutures had closed and there wasn't any risk of an infection, I started using it, and seeing how quickly his swelling resolved, his pain went down, his range of motion improved. I was able to really kind of be able to speed up his process and was able to cut 2 weeks off of his full recovery time, whereas orthopedic had cleared him to go back to full contact, didn't have any issues with it whatsoever, felt great. And it was just really interesting to see that. I've also had an acute ankle sprain that I used it on, and the same thing. Some of those initial responses I'd see before of seeing significant swelling and having to work on using like an ACE wrap or Game Ready to help decrease that and their pain, I'm seeing like a significant reduction. If I use it right after the injury, day one, they'll have a pain of like, let's say a 7 or an 8. Next day, they'll say it's a 3 or a 4. And then the next treatment session we do it, they'll be even lower. And I'm just seeing that response from that the shockwave is putting on the cells. I'm seeing that response where it's speeding up that initial response time and really getting the body to kind of say, okay, we're done with the injury. We're going to get now into healing, repairing the injured structure and moving forward. And that's allowing me to kind of speed up their recovery time significantly to get them back onto the mat, and not only be back on the mat and be able to perform at a high level. It's not like they're back on the mat, but it hurts. So they're limited, or they might be dealing with some pain. I'm seeing them say, oh, I feel great. I don't have any issues. They're kind of back a lot quicker than I was being able to get them before.
It's so interesting you mentioned that. I think you said it such a wonderful way. I'll tell you, we integrated this technology into the Washington Commanders recently, which was one of the first, outside of, a college team, is the first professional sports teams we've worked with. And we called them after a couple of weeks and we asked them, like, what are you guys noticing? What are you guys seeing? Talk to us about some of the major benefits. And one of the things they said was almost identical to what you said, obviously a little bit different, but what they said was, we have so many veteran athletes here that are at a point in their career where the difference in them just being able to get on the field for this game or for this practice, or just play one more game or get an extra 2 weeks out of this, it could be the difference between a win and a loss for us. And so the difference in having this and being able to get them back out on the field faster, whereas for us, it may have taken 4 weeks, now it's taking a week. That difference for an athlete is everything. And it might not be the difference for a 66-year-old woman who's been considering a knee replacement for the last 3 years and is really thinking about it. A day or two might not matter for her. But for an athlete, a day or two is everything. So I'm curious if that rings true for you guys.
Most definitely. Just more recently, I had an athlete that's had a pretty significant MCL sprain. Same thing. I'm just able. He heard it on Sunday. I used it Monday. Yesterday, he felt good enough, like he's back on a biking with a significant MCL sprain with no pain. We're able to get like a little bit of a cardio workout in. And as I use it, I'm probably going to do another treatment session today as we keep going. I've just been able to see this just every day it gets better and it's speeding it up. And so I'm able to hit those milestones and, like the Commanders are saying, get them back quicker. So it's not as much of a timeline that we're kind of working with. I feel like I'm able to kind of be on the side of saying, well, we're going to get them back quicker than that.
Now, a lot of people that are here, they actually have not used the technology yet. And so they don't know exactly what to expect during a treatment or during a care plan or everything like this. And so, of course, it differs tremendously when you're dealing with athletes, especially in-season athletes and different types of conditions. But could you just give us an idea of like what you're seeing treatment by treatment? How do you run an initial visit where you're doing mapping? Walk us through the I guess maybe not the care plans, but the treatment plans that you're putting together for some of these athletes.
So kind of what I've been doing, just because with the acute injuries, I've been going probably about 3 times a week, so every other day using it. And I actually really like the mapping part because you can almost use it as a diagnostic tool to kind of find those injured structures. So I kind of start initially just at a lower intensity and just kind of build it up and kind of just find those hot spots of where I need to focus my treatment on. And then I'm usually running about 400 to 500 shocks at the most. I haven't done a lot of any higher shocks, but for that, I've kind of seen good results with doing 400 to 500 shocks. And then I also, based on our heavyweight and talking to his parents who have used the unit, they've done, like they call it contrasting, where they've changed, maybe going with 2 shocks per second instead of doing 4 shocks and kind of changing that treatment up. And that, I guess there's been some conversations about that, maybe change that cell response being different and getting that different delivery might also give some response as well. So I've kind of been playing around with that too and been getting good results. But that's typically kind of what I've been using it for, is it's when I have an acute injury and then going with about 3 times a week. I might also, if it's just like a recovery thing, it's just more, I'll do like the 4 shocks, kind of the I call it rapid fire, just 500 shocks, just kind of over the area that's sore, and do that post recovery. That's the biggest thing too, is I use it after my practices. I'm not using it before. I've seen that if I use it after practice and let the body have that full recovery time to react to the shock wave, that I'm able to get them to feel really good the next day.
And give everyone an idea, like, I think we hear a lot of concerns from busy medical professionals who tell us that while this may look clinically great, this may be pretty hard to integrate into a day-to-day. Now, as an athletic trainer who oversees a team of 33 people who are like running crazy all the time, and you're doing nutrition, you're doing weightlifting, you're doing this, you're doing that, like you've got stuff going on all the time. Give us an idea, like how long did the treatments take? Is it quick? Is it efficient? How have you integrated this into your daily routine? And has it slowed things down or sped things up?
Their treatments are typically 3 to 5 minutes. So it has not changed. I would say really changed how I do things. I would say it's no different than if I was using like a laser. It's typically about the same time frame of what you would need to do for that treatment, or even ultrasound for that matter. It's kind of just been able to be integrated, just like if I was using that for another athlete. Of you might have an athlete doing a hot pack, or you might put them on stim or something, and you might do something to give them a little bit of time as you're working through it. But it's able to work pretty quickly to where I'm efficiently getting guys out after practice. I'm not staying here 2 or 3 hours after practice making sure guys get treatment. I mean, I'm able to get the guys, the 10 to 15 guys that maybe need something. Maybe out of those 10 to 15, 5 to 6 want shockwave. I'm able to get them out in an hour and in a very efficient, timely manner.
And now that you've had the technology for, how long have you guys had it? Maybe 2 months?
Yeah, almost 3 months.
2, almost 3 months. Now, like looking back at it, it seems like it's changed things for you guys in the day to day and just how you guys operate and what you guys do and what you're able to do with the athletes, how fast you're able to make them recover. I'm curious, like, do you feel like you have a competitive edge in some sense over institutions that maybe don't have this? Because truth be told, I can't tell you the number of athletic institutions I've walked into, some of the most elite level athletic institutions, or so you would think, in the country, and they don't even have any type of equipment like this whatsoever. I mean, what do you mean you don't have anything? This is an NBA team. What do you mean you don't have anything like this? So I'm curious, do you feel like you have a competitive edge, and how would things be if you didn't have it? Like, how has this separated you from where you guys were before?
I definitely think it brings a competitive edge. One of the things just for wrestling, so our new head coach actually came from Penn State. He was an athlete competing at the Olympic level and retired, and we ended up hiring him as our next head coach. And they had a case at Penn State where they had a kid have an ACL tear right before the national tournament, and they were using not StemWave, but a different unit, and used it on him religiously up until the tournament. And to see this guy that was a very high level athlete, he was predicted to win the national title, be able to put a brace on, wrestle, and win a national title, and be able to be very functional. Kind of was a story where I'm like, okay, this is a game changer, and I'm excited to be able to have that with StemWave, of being able to now have, if I have a traumatic injury like that, I feel pretty confident knowing I can use this device to help really speed up that recovery process. And if there is a time crunch, aka like we are a week, 2 weeks away from the national tournament, the guy qualified, it's do or die, you go, you don't go. I think this is going to be able to put them in a position to be as functional as they can be, and also perform at a high level and be able to really speed up that process. There's been some times in the past where I've had crazy injuries that I feel like maybe if I had StemWave, it would have been a little better than how they performed. And I'm really excited to see, hopefully not be in a position where I have to do that, but if I do, I'd be really excited to be able to implement it and see that. I definitely think there's a competitive edge to it for sure.
Yeah, it's always better to know you have the artillery than not have it at all, right? Yeah. So that's really good to hear. Now, one of the things I got a question that came in a minute ago, and I'd be happy to explain it, but I think it would be useful for other people to hear it from you. Is somebody messaged and said he talked about mapping. What was mapping? They messaged me directly. Why don't you explain the process of what mapping is and how you use it? Because this is very unconventional for most athletic trainers, physical therapists, and chiropractors who are used to using their hands and kind of detecting things based on sight and hearing and communicating back and forth with the patient. But explain what mapping is and how it works.
Mapping essentially is just, you're kind of almost scanning over the area you're treating. So I'll use the knee as an example, but mapping, what you're doing, you kind of start at a lower intensity, and you can kind of start with, okay, where do they perceive pain? And you just kind of track over the area. So you will turn the intensity up till they can feel the pain, and you start tracking over the area, and you can actually find with the mapping different spots on the joint that were not painful. So it's different from using your hands and palpating, because you might find pain. Let's say they have an MCL sprain, they might have pain on the completely other side of their knee. Or they might have some pain up on the femur. You might feel some pain down the patellar tendon, and you're able to almost just find where the damaged tissue is. Essentially, that's what mapping is. You're trying to find the tissue that's dysfunctional, that's damaged, injured, and you're able to kind of use that. And that's why I use, say, a diagnostic tools. It helps me kind of identify areas of where there's swelling, inflammation, and pain, and know that's the areas we need to treat. So mapping essentially is trying to find where do you need to treat the area, not necessarily treating what you think the injury is, but treating where the pain is, so that you can get the results you're looking for.
Yeah, it's literally could not have been explained better. Now, a lot of people that join us today and speak to our team and are exploring this technology, many of them have, there's over 10,000 white papers on this type of technology. They've gone through the rabbit hole of understanding how it works. They've heard it on a podcast. They've heard someone else talk about it, and they haven't tried it themselves. And they really just want to know, does it work in the way that, these people are talking about it? Does it work in the way that I saw online or I read on the website? And I guess I would just ask you, Nick, what would you say to, maybe a medical professional who has sat on the sideline for a year or 2 years, or maybe even 3 years in looking at this technology for their athletes, but just hasn't pulled the trigger on it because they're not sure if it's actually going to get the results that they heard?
I would tell them that they will get the results, and I think this is kind of the next generation of things you're going to see. I can see this being in the next 5 to 10 years, almost being an expectation in athletic training rooms and sports medicine facilities and clinics, just because of how powerful it is. I think you're able to get a lot done, and it's in a short treatment time and get the results you're looking for. And it's almost kind of like, I feel like it's described as like kind of just mind blowing a little bit that we just haven't had this for a long time. Because I feel like it's one of those things, like there's a lot of check techniques out there and they'll tell you it's supposed to do it, but you might not see those results. This was one that from the get go, you're getting told all these things that sound, oh, this is great. This sounds kind of utopian in a way, but then I'm now seeing that. And it's like, okay, this is legit. This is real. I'm getting great patient feedback. I'm getting really good results. This is 100% something that needs to start being pushed as kind of the norm. And that's what I think I would tell somebody that's been out for a year, is like, this is going to be the new norm. You're going to see this coming out and being what you need to have in order to provide the best care for your athlete.
And it already is, right? I mean, it's over 500 private offices throughout the country, multiple athletic institutions and elite level institutions like Oklahoma State University. Now, a lot of people have a concern that with the technology that's getting results, of this magnitude, surely it must be complicated to get started and get integrated and get it going and being able to use it in a medical setting. Obviously, you've been through our process, right? You had, one of our lead clinical advisors come out and spend the day with you and hang out and, talk through exactly how it works. How was it going from, I don't really know much about this technology at all, to I'm going to start treating some athletes? Like, how big was that distance for you to learn?
For me, it was not a lot. Some of my colleagues, I would say, is a little more, I think just out of being skeptical. And that's where I think I kind of just tried to pioneer that on our staff. I was like, I'm just going to take a risk. We were in our off season, kind of just about to start preseason when we implemented it. So I felt comfortable being able to kind of use some of my guys as guinea pigs, essentially, to kind of see what we get. If they had something come up, I just wanted to try it. I just put it on everything, basically just said, let's just see what works, what I'm getting good results with, what I'm not seeing maybe as good of results with, for something else. And I noticed as I started doing that, so my colleagues started as well, and it just eventually became to where everybody started using it, trying it out. But it was pretty streamlined. I didn't have a lot of questions after we were trained. I felt pretty confident being able to treat our athletes and just get right into doing it. And it was very streamless, easy, no issues.
Yeah, and to give everybody an idea on like what Nick went through to get to that point where he can actually start treating some athletes, our training process is very simple. We do a 1-day training where we really take you from I'm interested and I really want to get the results like I saw online to I can confidently go home and treat my patients. We do that in a 1-day session. It's very straightforward. We cover all the technology and then we actually do treatments with you. We show you exactly how it works. We walk you through the whole thing and we make sure that everybody who leaves, they're good to go. Like they feel like they can do it. And of course, it's not going to be perfect day one. Like Nick, I'm sure your first couple of treatments, you're like, oh, I didn't know that. Or, oh, I didn't know this. And you have to work through those things. But over time, you learn them. And what we've done is we built a community of hundreds of medical professionals all throughout the country. That way, if anything goes wrong or you have any questions or you see a case, that you haven't seen before or something, we're totally here. And I'm sure that's probably happened for you, Nick, where you've seen something, you're like, oh, I got to text Dr. Manison about this. Like, I gotta ask some questions. Like, have there been anything that has came up that you're like, I got to check in and ask for some advice here?
Nothing super specific, but I do look pretty often in that group just to see what people ask, because sometimes I just don't think of something that I might be able to use it for, and then I go look and I'm like, oh, there's kind of a protocol for that. Maybe the one thing is just using it on like vertebral discs. And Dr.
Mhm.
Madison kind of, when he came to train us, kind of talks about the protocol and the that you guys came out with for that. And so I was able to kind of start that a little early, but that was kind of the biggest one I had. But I just like looking in there just to see what other people are using it for, or what other people are seeing. Because every once in a while, I'll see something that I was like, I didn't think about using StemWave for this. And then seeing that
Yeah.
it could be effective, it's like, okay, I can add that now into my repertoire if I see that.
Again, and yeah, what Nick's referring to is just this community of medical professionals who are all doing the same thing, and they're, in a sense, practicing medicine and really sharing, their experience. So, listen, in the last couple of minutes that we have here, for everyone who's here via Zoom or Facebook or wherever you are, what we always love to do just in the last couple of minutes is we love to get some questions answered. So I have a list of questions that I came in with, that people have just messaged throughout while we've been on the call, or they emailed me prior. So we'll answer some of those questions. But if you're here live on the call and you have any questions, you can just drop it directly in the chat. You can message me privately, or you can just unmute yourself if you're feeling courageous, and you can come right up and ask any questions. We'll take a couple minutes to answer some questions, and then we've got something special for you guys at the end if you stick around. So with that, I'll answer the first question, which is, you were talking about the level of improvement you see, how many visits you do, and everything like that, Nick. Somebody asked, is there linear progression per treatment? I think they're just trying to ask, like, do you see progress every treatment? Like, how, kind of walk us through what you see.
Yeah, I see progress. As I get kind of towards the late stages of their injury and that recovery, they'll kind of get to a point where I think it plateaus to where I think we got what we're going to get out of it. And now it's just getting their strength back and building their confidence back into it. But in that first 1 to 2 weeks, I'm seeing a linear progression of every time I use it, they're getting improvement and they're going the right direction. Or if we take a step back, I use it and then they go back to where they were. If that's something like they tweaked it, like we're returning to play and they tweaked it a little bit and it's inflamed, I use it. Okay, now they're back to where they were yesterday.
Yep. Okay, that's a great way to answer that. So we've got two more great questions that just came in. One of them, and maybe I'll answer this one and see if you have anything to add to this, Nick, which is there a maximum number of treatments that can be done within a certain time period? What I'll tell you, Kim, is that we're always optimizing the protocol for the best outcome for the patient. And so the way that we've optimized that protocol is as follows. Generally speaking, it's going to be 2 visits per week in the first 2 weeks. So 2 visits first week, 2 visits second week, and then 1 visit every week after that. That generally is going to run for a total of about 10 to 12 visits. And then depending on the lifestyle of the patient and the condition of the patient, we're probably going to have some form of ongoing treatment. It might be every month, it might be every 2 months, might be every 90 days, might be every 6 months to check in with them. It just depends on how active their lifestyle is. If they're 68 years old and they hike every Sunday and run a mile every morning, then we might want to see them a little bit more frequently than if they're a 26-year-old who's just finished up college and lives a healthy life. So in terms of maximum number of treatments, the maximum number of treatments is at a certain point, it's not effective to do more than the protocol, right? It's not like one of those things where you just do more of it and all of a sudden everything is better. So the maximum number of treatments is really the protocol. That's what we would say. Nick, I don't know if you have anything to add to that or anything you'd say that's different.
I would agree with that. I think if in cases where I maybe try a little more, I don't feel like I've seen anything that tells me otherwise.
Somebody just asked, it looks like Pat is seeing high school athletes, a lot of who have shin splints. Is that something you've dealt with, Nick?
Not me, but I know our cross country and track athletes have been using it fairly often on shin splints. We actually had a case of a stress fracture that they used it on too, and we're able to see that healing component, which was very, very cool to see. But they've seen a lot of good results with it.
Yeah, that's great to hear. We got another question from Jason who said, for arm care, baseball pitching injuries, football QB throwing, have you seen it be used for that? How long has the recovery been?
Not necessarily for them. Our baseball AT, it's not usually up in this facility. I know just for me, I have I'm not necessarily an external rotation throwing sport, but we have more internal rotation stuff. So some of my guys will be very sore after wrestling, just kind of in this area. And I've used it just kind of as a post recovery, and been able to see them get some resolvement with it. So not necessarily for the backside of the shoulder, but kind of for my specific sport of having kind of the overuse part of them trying to pull, grab onto another person and wrestle. I've been able to see some of those results.
Yeah, and I guess if you really think about the question too, like Jason, I personally don't deal with those types of athletes, but if you think about what the type of athlete is and what they'd be dealing with, like a quarterback or a baseball pitcher, it's like probably a rotator cuff tear, some form of tendonitis, labral tears, like a slap lesion, or an impingement, or bicep tendonitis, like those types of things. The answer is like, of course, those are phenomenal cases for StemWave. Those are extremely common cases. And if it's a case where it's had to go surgical for a variety of different reasons, post-surgical, I mean, it's like not having StemWave in a post-surgical setting is like, we're just leaving opportunity on the table in terms of an athlete having a good recovery time. So Jason, the answer is absolutely, it's been used for that. In terms of how has the recovery been, what we expect, generally speaking, is one, if it's a surgery, we expect the recovery to be a lot quicker. We've seen it, on average, hard to say exactly what it should be, but I've seen, like, we just saw a post ACL tear. We just saw somebody who had a post ACL tear. They're actually an employee at the company. 4 months post surgery, they're on a hike in Portugal, right? I mean, like, there's, I'm not going to say that's going to be common or the standard or anything like that, but the recovery has been pretty solid. It's patient specific, though, I'll say. We've got another question from Kaz. How would you go about monitoring the progress with injuries that have a undetermined cause? Let's just answer the first part of that question. How do you monitor the progress with injuries?
I just get like a reported patient, basically feedback. So whether that's just me asking them like what their pain was before or after, or if I'm having them fill something out. Sometimes we have just in our kind of athlete monitoring system that we'll have that pushed out where we can kind of ask how their pain level is. That's kind of what I mainly do, is just kind of get feedback on where they felt before versus how they felt after the treatment.
Amazing. And we've got somebody who they look to be a patient in Harrisburg, Pennsylvania. They said, are there any offices near me in Harrisburg? E.g., the answer is absolutely. We have offices everywhere throughout the country. There's over 500 offices. The closest office to you is actually one of our clinical advisors, which is Dr. Anthony DiCesaro. He's phenomenal. His office is, if you just look up Dr. Anthony DiCesaro, I'll put it in the chat for you, and I'll have our team reach out to you. That way you can find him. And then, get introduced there. But okay, we got one follow-up from Kaz, which is, what if pain is not the limiting factor? Kaz, feel free to be more specific on exactly what you're asking. I'm getting the sense that there's a little bit of ambiguity there. But if pain is not the limiting factor, what I'll also say in terms of how we monitor progress, two things. Number one, StemWave provides you with progress sheets for the patient, like an intake form. And the way you really want to measure is just how you would measure anything else. You're going to sit down with the patient and you're going to quantify with the patient the pain that they're in. So when we're doing treatment, like Nick talked about, let's say we're running it over somebody's shoulder, we're going to be communicating back and forth with them during the mapping session to understand what level of pain they're in. We're also going to communicate with them prior to understand what's their range of motion, what are they able to do, what are they not able to do, really get an overall sense of where they're at. We're going to then do the treatment and also gain more context and more information through patient feedback during the treatment. And we're going to gauge with them on a scale of 1 to 10 on what level of pain they're in. So there's over 25 levels of the device in terms of energy. We're generally going to start at a low energy. We're going to see what level of pain they're at. We don't want them to be in much pain really at all during the treatment, maybe a 2, 3, or 4 out of 10, probably more in like the 2 or 3, just so we can understand where the area of damaged tissue and inflammation is. And then what'll happen, Kaz, is during the treatments, during the preceding treatments, you'll notice a few things. The first thing you'll notice is after a treatment, you'll notice there's an improvement in range of motion and a decrease in pain normally after the first visit. In fact, like, Nick can attest to this, we generally see anywhere from 10 to 20%, sometimes more, improvement on the first visit, again, as measured by a decrease in pain and improvement in range of motion. That's consistent through the visits. And you'll know that because you'll see improvements in range of motion. You'll see improvements as measured by decrease in pain. And you'll also be able to increase the energy that you're sending into the tissue while not increasing the pain. So maybe what would have been a, level 10 in terms of energy into the shoulder, maybe by week 3, it's a 12 or a 13, but we're not high on the pain scale whatsoever. We're like a 2 or 3. So that's what ends up happening. And you start seeing progression. So it's actually great because, Kaz, it's such a good question because you really do get to monitor it at an analytical level week by week by week by week. So it is really exciting. Now, as we're wrapping up here, I'll say one more thing, which is, wherever you're located, obviously, if you're on this call here today, you're looking into this technology for a variety of different reasons. Maybe some of you guys are looking into this technology because, like Nick, you have a lot of athletes, you have a lot of patients, you have a lot of people within your community that you could serve if you could get results, like Nick and so many other offices throughout the country are getting, and you'd be able to help them in another way. If that's you, and you're interested in providing another solution for these patients, and you're interested in taking your results to the next level and adding a form of non-invasive regenerative medicine to your office, the way to get started with StemWave is very, very simple. We'll place StemWave into your office for 60 days at absolutely no cost to you, meaning we literally take the technology, we put it into your office. We'll train you and your staff on how to be just as good as Nick is, so you can get awesome results like he's seeing. We'll train you up. This is all at no cost. We'll set everything up in your office. That way you can actually start getting patients integrated. We'll do the marketing to your patients and do the marketing locally just so we can get this thing off the ground. And within 60 days, 2 things are going to happen. The first thing that's going to happen is you're going to get incredible clinical results. I can't tell you, like 99 out of 100 people within the first 60 days, they call us and they say, this is insane. Like, I don't know how I was doing this without having this technology. Like, this is a total game changer for me. So that's the first thing that'll happen. The second thing that'll happen is for most private practices, now Nick doesn't own private practices, but the other 499 of our providers, most of them do, is it adds a considerable amount of revenue that is non-insurance covered to the practice. Our average provider adds anywhere from $5,000 to $25,000 in collections in cash per month to their practice. And so if those 2 things are important for you, first and foremost, number 1, getting amazing patient results, world-class patient results with a new regenerative technology that's non-invasive, if that's important for you and you'd like to grow your clinic in the process, you can get started with StemWave at absolutely no cost for 60 days. If for some reason you don't love the technology after 60 days, you don't pay and you don't have to keep it. Luckily, of the last 500 clinics that we've worked with, we've had a 98% success rate, meaning 98% of them move beyond the 60 days. And the key reason for that is just because the technology does such a heavy amount of the lifting, and our team has been through this over 500 times, which is enough to know how to get this thing done right. And so if all of that sounds interesting and you'd like to get started, and you just want to know how you can get started with this in your clinic, again, I'll state our offer one more time, which is you can try it. We'll place StemWave into your office at no cost to you for 60 days. We'll train you and your staff on how to get started with it. And the way to get started is very simple. You just click the link that I just dropped in the chat, which is stemwave.com. You go there, you click in the top right, book a call with our team. Full disclosure, we do not work with every office. So, not every office is a good fit for our technology for a variety of different reasons. But the way to see if you qualify is really just to speak to our team. It's not a typical sales call. We'll really just be understanding what type of patients you deal with, making sure that our technology can actually help and serve those types of patients. And if we see that there's a lot of synergy, we'd be happy to have another call where we go a little bit deeper into how that would work. So we've got somebody who just messaged in there and said, getting their unit next month. Very excited. Hey, we're super excited for you too. I can't wait to hear your story and your journey and all the patients that you get to help. But with that, Nick, I just want to thank you a ton for, coming here today. And, the success that you guys have had with the technology just in the last 2 or 3 months has been really impressive and exciting. And, it's one of the first institutions. We've only worked with a handful, and To know that it's already working so well for you guys is really exciting, and just reinvigorates our whole StemWave team, because that's really what we're in it for. So I just want to thank you so much for your time, and I'm wishing you a continued level of success with your athletes.
Thank you. I'm happy I was able to share the results that we're getting.
Amazing. Well, thank you so much, everyone, for coming. And I hope everybody has a wonderful week. I hope everybody has a beautiful Thanksgiving. And reminder, you can just go to StemWave.com if you're interested in getting started. And I look forward to hearing your story. Have a good day, everybody. Bye, Nick.